Welcome everyone to the statewide Medicaid Managed Care Managed Medical Assistance Program webinar for Managed Medical Assistance Potential Network Providers. This presentation will teach you about specialty plans and the statewide Medicaid Managed Care Program. To access today's presentation, please visit the link below, aca.myflorida.com/SMMC, and select the News and Events tab under the header image. Note, you can also use the red button to sign up for SMMC program updates via email. Next, please select Event Training Materials to download the slides from today's presentation. You may also view details regarding future SMMC events by selecting the Calendar of Events and Training. Last, choose the files you would like to save. Another note, you may also view files from past events and ACA guidance statements or submit questions to be answered in future presentations. Now that everyone has had a chance to download today's presentation, let me introduce you to today's presenter. We have Heather Allman with the Agency for Healthcare Administration. I will now hand you over to Heather.
I'm going to start out with a brief overview of the SMMC program. Why are changes being made to Florida's Medicaid program? Because of the statewide Medicaid Managed Care SMMC program, the agency is changing how a majority of individuals receive most health care services from Florida Medicaid. The statewide Medicaid Managed Care program has two components. The first component is the long-term care program, which operates statewide as of March 2014. The last region was implemented, and the implementation of that program is now complete, and it is operating statewide. The second component of the statewide Medicaid Managed Care program is the Managed Medical Assistance Program. That program will begin implementation May 1st of 2014, and that implementation will continue through August 1st of 2014. The Managed Medical Assistance Program provides primary care, acute care, dental, and behavioral health care services to recipients eligible for enrollment. Under the MMA program, plans can participate as standard plans or as specialty plans. A specialty plan is a managed care plan that serves Medicaid recipients who meet specified criteria based on age, medical condition, or diagnosis. When a specialty plan is available to accommodate a specific condition or diagnosis of a recipient, the agency will assign the recipient to that plan. Recipients can always choose to enroll in a standard MMA plan even if they are eligible for a specialty plan enrollment. What makes specialty plans unique? MMA specialty plans are required to cover the same services available in the non-specialty plans and must meet provider network standards outlined for a standard plan. What is different? Each specialty plan will provide an agency-approved care coordination or case management program which is specific to the specialty population. Specialty plans may offer additional expanded benefits. Specialty plans may report on additional performance measures, and specialty plans may have enhanced provider network standards. Where will specialty plans operate? Each specialty plan may not be available in all 11 regions of the state. The Child Welfare Specialty Plan, which is operated by Sunshine, and the Children's Medical Services Network plan will be available statewide. What specialty plans are available? This table depicts the MMA specialty plans and where they're located throughout the state. So across the top you can see that there's a specialty plan for recipients with HIV or AIDS, and they're operated by Clear Health Alliance. We also have another specialty plan for HIV and AIDS through Positive Healthcare. And then across the bottom, the X's will show you where those plans are located throughout the state. The Children's Medical Services Network for children with chronic conditions is available across the state. The Magellan Complete Care Specialty Plan for recipients with serious mental illness is available in regions 2, 4, 5, 6, 7, 9, 10, and 11. Sunshine Health Plan is a specialty plan for children and child welfare, and that's available statewide also. And the Freedom Health Plan for dually eligible recipients with cardiovascular disease, chronic obstructive pulmonary disease, congestive heart failure, and diabetes is available in regions 3, 5, 6, 7, 8, 9, 10, and 11. And please note that Magellan Complete Care will not begin operation until July 1st of 2014. Children's Medical Services Network Plan will not begin operations until August 1st of 2014, and Freedom Health will not begin operations until January 1st of 2015. Specialty Plan Assignment. The agency is required by Florida law to automatically enroll Medicaid recipients into a managed care plan if they do not voluntarily choose a plan. When a specialty plan is available to serve a specific condition or diagnosis of a recipient, the agency is required to assign the recipient to that plan. Again, as I mentioned earlier, if a recipient does not want to be in a specialty plan, they will be able to choose a standard MMA plan instead. The agency employs a hierarchy for assignment to specialty plans in those instances where a recipient qualifies for enrollment into more than one specialty plan. This is the hierarchy for assignment of specialty plans. If a recipient qualifies for enrollment in more than one of the available specialty plans and does not make a voluntary choice, they'll be assigned to the plan for which they qualify that appears highest in this chart, beginning with child welfare, and then the Children's Medical Services Network, the HIV/AIDS specialty plans, the Serious Mental Illness specialty plan, and the Dual Eligible with Chronic Conditions plan. Who can enroll in a specialty plan? Each specialty plan is designed to serve a unique population. Each population must have defined specific criteria based on age, medical condition, or diagnosis per Florida law. A recipient must meet the specified criteria in order to enroll in a specific specialty plan. For the most part, the agency will identify recipients who are eligible to enroll in a specialty plan. However, specialty plans may develop and implement policies and procedures which are subject to agency approval to screen recipients meeting the specialty plan eligibility criteria and who have not been identified by the agency. This table depicts specialty plan enrollment criteria. These are some of the basic criteria for each plan. For the child welfare plan, Medicaid recipients must be under the age of 21 and have an open case for child welfare services in the Department of Children and Families Florida Safe Families Network database. For the Serious Mental Illness plan, Medicaid recipients must be diagnosed with schizophrenia, bipolar disorder, major depressive disorder, or obsessive-compulsive disorder. The agency will identify the eligible population using specific diagnosis codes and/or medications used to treat the diagnoses specified above. For the Children's Medical Services Network Plan, Medicaid recipients must be under the age of 21 and meet the Department of Health's clinical screening criteria for chronic conditions. As a reminder, this plan does not begin operation until August 1st, 2014, statewide. For the HIV and AIDS plans, Medicaid recipients must be diagnosed with HIV or AIDS, and the agency will identify those eligible recipients using specific diagnosis codes, laboratory procedure codes, and/or medications commonly used to treat HIV or AIDS. For the chronic conditions plan, Medicaid recipients must be aged 21 and older, and eligible for both Medicare and full Medicaid benefits with a diagnosis of diabetes, chronic obstructive pulmonary disease, congestive heart failure, or cardiovascular disease. And again, this plan will begin operations January 1, 2015. Expanded benefits. All managed care plans participating in the SMMC program have the opportunity to offer expanded benefits to their enrollees. Expanded benefits are services that are offered in addition to those available through the Medicaid program. Plans can exceed the limits stated in Medicaid policy for certain services or offer additional services not covered under the Medicaid state plan, such as art therapy or post-discharge meals. Specialty plans can choose to offer expanded benefits tailored to their unique population. This is a list of the expanded benefits that are available through the specialty plans. Child welfare, the HIV and AIDS plan for Clear Health or the HIV and AIDS plan with Positive, and the serious mental illness plan. Details regarding the scope of covered services may vary by managed care plan, and the Children's Medical Services plan and the specialty plan for dual eligibles with chronic conditions do not offer expanded benefits. What providers are included in the specialty plan network? Specialty plans must include practitioners with training and demonstrated experience in treating persons with the identified disorder within their network. These specialized providers can be designated as primary care providers. For child welfare, physicians with training and demonstrated experience in treating children with behavioral health needs. For the serious mental illness plan, physicians with training and demonstrated experience in treating persons with severe mental illness. For the HIV and AIDS plan, HIV and AIDS specialist physicians with training and demonstrated experience in treating HIV and AIDS recipients. This slide depicts the enhanced provider network ratios for some of the specialty plans. So as you can see, there are reduced numbers, actually is an increased number of required providers over the standard MMA plan network adequacy ratios. So for example, for the child welfare plan, primary care physicians, the child welfare plan is required to have one for every 1,000 enrollees, whereas the standard plans are required to have one provider for every 1,500 enrollees. And for licensed practitioners of the healing arts, the child welfare plan is required to have one for 1,000 enrollees, and the standard plans are required to have one for 1,500 enrollees. For the serious mental illness plan, there are enhanced provider ratios for primary care providers, 24-hour pharmacies, board-certified or board-eligible adult psychiatrists, fully accredited psychiatric community hospitals for adults, or crisis stabilization units and freestanding psychiatric specialty hospitals, inpatient substance abuse detox units, fully accredited psychiatric community hospitals for children, and for the HIV/AIDS plans, they will have one for every 500 enrollees, a HIV/AIDS primary care provider. Specialty plan specific care coordination and case management. Each specialty plan will develop, implement, and maintain an agency-approved care coordination or case management program specific to specialty plan enrollees. Care coordination and case management is a process that assesses, plans, implements, coordinates, monitors, and evaluates the options and services required to meet an enrollee's health needs using communication and all available resources to promote quality outcomes. Proper care coordination or case management occurs across the continuum of care, addressing the ongoing individual needs of an enrollee rather than being restricted to a single practice setting. What is included in specialty plan-specific care coordination or case management? Assessment and reassessment of the acuity level and service needs of each enrollee. Care planning for mental health treatment that is tailored to the individual enrollee and is in agreement with evidence-based guidelines. Coordination of care through all levels of practitioner care, primary care to specialists. Monitoring compliance with scheduled appointments, laboratory results, and medication adherence. Coordination with and referrals to providers of specialty care services for enrollees. Interventions to avoid unnecessary use of emergency departments, inpatient care, and other acute care services. Patient education to assist enrollees in better management of health issues, including the principles of recovery and resiliency, and linking enrollees to communities or other support services. Additional performance measures. Performance measures are a set of measures used to report the performance of managed care plans. Recipients can use performance measures to compare managed care plans and determine the quality of care that's being provided. Managed care plans use performance measures to understand what is working well and to determine where and what changes need to be made to improve the quality of care. The agency uses performance measures to determine whether plans are meeting the goal of improving patient outcomes. In addition to performance measures required of all MMA plans, specialty plans must collect data and report on additional performance measures that are appropriate to the specialty plan population. Examples of additional specialty plan performance measures for the Child Welfare and Children's Medical Services plans, children on higher than recommended doses of antipsychotic medications. For the HIV and AIDS plans, linkage to HIV medical care. For the serious mental illness plan, diabetes screening for people with schizophrenia or bipolar disorder who are using an antipsychotic medication. Chronic conditions. All measures required by the Quality Rating System for Medicare Advantage plans established by the Centers for Medicare and Medicaid Services, applicable to the Medicare Advantage Coordinated Care Plans. Additional liquidated damages. All SMMC contracts, including specialty plan contracts, include liquidated damages for failure to meet certain performance requirements in the contract. Additional standards specific to the specialty population. Failure to verify specialty population eligibility criteria of an enrolled recipient within timeframes in the plan's policies and procedures is a liquidated damage of $150 a day, and failure to comply with required policies and procedures is a $1,000 per occurrence liquidated damage. Continuity of care during the transition to MMA. Healthcare providers should not cancel appointments with current patients. MMA plans must honor an ongoing treatment for up to 60 days after MMA starts in each region. That was authorized prior to the recipient's enrollment into the plan. Providers will be paid. Providers should continue providing any services that were previously authorized, regardless of whether the provider is participating in the plan's network. Plans must pay for previously authorized services for up to 60 days after MMA starts in each region, and must pay providers at the rate previously received for up to 30 days. Prescriptions will be honored. Plans must allow recipients to continue to receive their prescriptions through their current provider for up to 60 days after MMA starts in each region, until their prescriptions can be transferred to a provider in the plan's network. This page shows some additional resources or where you can locate additional resources on the SMMC website. Questions can be emailed to flmedicaidmanagedcare@ahca.myflorida.com. Updates about the statewide Medicaid Managed Care Program are posted at www.ahca.myflorida.com/SMMC. Upcoming news and events can be found on the News and Events tab that's circled in red. You can sign up for our mailing list by clicking on the red Program Update box on the right-hand side of the page, also circled in red. And you can also see listed there a link to a form to report a complaint or an issue, and in the gray box, the frequently asked questions. And these are some additional resources that are available through social media sites. We have a YouTube account, a Facebook account, a Twitter account, and a SlideShare, which these presentations are also posted.
And I would like to remind you to send any questions that you may have to flmedicaidmanagedcare@aca.myflorida.com. Thank you for participating in today's presentation, and have a great day.